Hi, everyone. Thanks for joining this session on how publishers can increase discoverability, readership, downloads, and ultimately citations for their journals. I'm sure I don't need to tell this audience why citations are important. In spite of all the ways that we would like to de-emphasize our industry's obsession with this unforgiving metric, impact factors are still the most popular way that authors evaluate where they will submit their work for publication. The first hurdle that must be cleared before an article can be cited is discovery. With over 2.5 million scholarly articles published each year, more than 8,000 each day, publishers, journal managers, and authors increasingly compete for readers' attention. Publishers use a number of strategies to capture that attention. Press releases, search engine optimization, email outreach, and social media are the usual ways to raise awareness, and results can be measured in page views and clicks. Increasing citations, however, requires another level of discovery. It means reaching those researchers who are most likely to engage with the content and to ultimately cite it in their own published work. Can that be done? The answer is yes. And I'm going to show you some case studies and research that demonstrate how TrendMD can promote scholarly content and has been able to increase citations and ultimately even raise impact factors for scholarly journals. I'll start with a quick overview of content marketing and show how TrendMD fits into a publisher's overall content marketing strategy. I'll show a couple of examples of publishers who have successfully used TrendMD to help make sure that their time-critical information about COVID-19 could rise above the glut of information that we've seen over the past year on the pandemic. I'll turn the floor over to Anand Rao of ASBMB, who will tell the story of how they launched a really fun content marketing campaign modeled on college basketball's March Madness to promote the JBC's articles on experimental methods. And I'll show some examples of journals that use TrendMD as part of a long-term strategy to raise their impact factors. And finally, I'll give highlights of a 12-month randomized controlled study that showed how TrendMD directly increased citations for a group of journals. First of all, what is content marketing and why should publishers care about it? The Content Marketing Institute defines it in this way: a strategic marketing approach. This implies a well thought out long-term commitment focused on creating and distributing valuable, relevant, and consistent content. Here's where I believe this is so well suited to the SSP audience. After all, is there any better way to describe scholarly content than valuable, relevant, and consistent? To attract and retain a clearly defined audience. We're talking here about researchers who are already interested in the subject, and ultimately to drive profitable customer action. In this case, finding and engaging with researchers and ultimately having them cite the content in their own work. So how does TrendMD fit into this scenario? TrendMD is a perfect example of content marketing at work in the sense that publishers use their own content to attract targeted readers to their websites, present them with additional relevant articles, and engage them with targeted ads, signups for events, or other activities. TrendMD's technology works to present the reader with content they are likely to find interesting based on what they are reading at the moment, what other users like them have read, and what they've read in the past. Recommendations are selected from the largest possible collection of content. Participating publishers represent some of the top journals from nearly every scholarly discipline. TrendMD uses the click behavior of more than 100 million readers per month to help predict those articles that are most likely to interest the reader. Let me explain how that works. Unlike a more like this recommender, which I'm sure you're all familiar with, TrendMD's technology uses collaborative filtering, which is similar to the way Amazon works. If you buy a teapot through Amazon, the site's not going to show you more teapots. You'll see products that other buyers of teapots have bought, like recipe books, teacups, or tea. In TrendMD's case, a medical practitioner reading an article in the BMJ on smoking hazards may see recommended articles on lung cancer, while a public health policy specialist may see articles on secondhand smoke. and a biochemical researcher may see articles on tumor formation. I'll now turn to some examples of how publishers have used TrendMD to promote their content. We're all too well aware of the information glut about COVID-19 over the past year or more. News and popular media have been full of stories reporting on every aspect of the pandemic, scientific, social, political, with highly variable levels of quality. Some are peer-reviewed, some in preprint, and some so newsworthy that they've been repeated and recycled through the mass media. Scholarly publishers have faced an ongoing dilemma of how to make sure their important papers and articles on this subject are not lost in all that noise. Here are examples of how two different scholarly publishers used TrendMD recommendations to make sure their articles got the attention they deserved. This publisher launched a campaign to promote 10 articles related to the coronavirus in March 2020 with a $1,000 budget. In less than 2 weeks, the campaign resulted in over 5.6 million impressions and over 1,600 clicks. This campaign started on February 1st, 2020, starting with 16 articles. Their total budget of $2,000 was set with daily limits for even pacing. The articles received over 9.6 million impressions and nearly 2,400 clicks, in other words, page views, during the month of February. I'm now going to turn to a part of a recent webinar on content marketing. In this recording from that session, Anand Rao of ASBMB will talk about a campaign that creatively combined several strategies, including promotion through TrendMD.
This is how scholarly publishers and societies can market with intention. And I'm going to give some examples today about a few ways that we do this at ASBMB and how we really leverage the talent that we have, who our team's experience is varied. And that's a strength, not a weakness, because we have scientific backgrounds, we have marketing backgrounds, we have communications backgrounds, and all of those individual people bring something different to the table. And by leveraging that, we can come up with some really great things. So before I get into the individual campaigns, I want to speak a little bit about the society and why it was important for us to take some new approaches with our campaign marketing, or marketing campaigns, sorry. And first, the society's been around since 1906, so it's established and it has a lot of members, but also we have 3 journals that are affiliated with our society. And the Journal of Biological Chemistry specifically has been around for over 115 years. And you can imagine that during that time, a lot has changed. The competitive landscape has changed. The channels that you can use to reach your audience has changed. And along with that change, there needs to be an evolution of how we approach our audience in what their values are and what our value proposition for them is, how our journals differentiate from the competition, and also how can we best boost the visibility of their research in order to best serve them. Because in order for research to be valuable, the right audience needs to be reading it. And that's something that should always be on the minds of publishers. And that's one thing that I'll talk about as well. So we'll answer that first question first. And to do so, we created a campaign called Methods Madness. And Methods Madness is a social media-based content marketing campaign that was meant to highlight the methods and resources articles in the JBC. And what was particularly creative about this was that we brought together our team of technical editors, scientific editors, myself as a science communicator, and our marketing department to create a campaign that both curated content, as Colleen mentioned, as one type of marketing, but also was entertaining by playing off the idea of March Madness, the famous basketball tournaments that brings together college basketball teams and pits them against one another to crown a champion. So our technical editors and myself actually went through some of the most prominent methodologies used in biochemistry and identified 16 that were well represented in our journals. And we created 2 categories: legendary, evergreen techniques that have been used for decades, and rising stars like CRISPR or cryo-EM that are just now getting a foothold and becoming more prominent, but still do phenomenal things for science. And we had them go against each other all through Twitter, the social media platform Twitter, where people could vote. And this occurred, sorry about that. This occurred throughout the month of March, just as the basketball tournament does. The voting took place on Twitter, and what was very interesting to see is we did get that army of free marketers, as Colleen mentioned. As the scientific community, we brought this content to the scientific community, and as they engaged, they shared our polls, they shared the tournament, and that created its own snowball effect and led to thousands of people voting in these polls and hashtags being created. One interesting fact about this campaign is that Team Mass Spec has now gone from just being related to this tournament to being the hashtag that the Mass Spec community uses every time they share a paper. And that came out of, what's really neat is it came out of this marketing campaign. So it was really a fun thing to do. And one other thing that we did is that we didn't just use social media, we leveraged the other channels that we have within the society to spread the word as well. And so on the right, you can see that I wrote a sports journalist style article about the tournament in our member magazine so that all of those 11,000 society members were able to get an update on the tournament and who ended up coming out on top at the end. We also created a virtual issue, which is a collection of articles within the JVC that centered around the teams that made the Final Four. So it was CRISPR, cryo-EM, PCR, and mass spec that made it to the end. And so I found articles that have been published since 2017 that were centered around those 4 techniques. And this was also an area of opportunity for partnership. I worked closely with Gina Ford of TrendMD and sent along the articles that I had found in the JVC. And she was able to take those and not only provide a signal boost for those articles, which you can see here on the bottom and the number of impressions that TrendMD generated, but also then link to content that was related within ASBMB journals so that we were able to generate clicks for other aspects of or other articles and content from ASBMB journals as well. So this was a really, I think, multifaceted campaign that ended up showing some results. And here they are. When we analyzed the hashtag that we created for this tournament, which was JVC, hashtag JVC Methods Madness, we found that nearly 2,000 original tweets were created in relation to that hashtag and campaign. And that led to over 5 million potential impacts, 810 individual contributors. And if we were to have paid for someone to do this individually, its approximate economic value was around $10,000. And JVC content itself was accessed over 1,000 times, which increased our profile visits to over 400%. And so these are interesting outcome measures. I think that it speaks to that usage and citation metric that Colleen was speaking about, but also it led to more submissions, which is the ultimate goal for any journal. And so in 2019, we had just over 100 submissions to the Methods article category, and we saw a 44% increase following the Methods Madness campaign in 2020. So that is, I think, taking some of these marketing concepts from the beginning, using and leveraging all the talents of our team, and then putting it into action to see results. Another thing that I didn't anticipate but was really pleasant to see was that a lot of really prominent scientists in the field of mass spec and structural biology engaged and were participating in this marketing campaign. And that actually led to us reaching out to them and submitting commissioned pieces or submitting articles. So the Garcia lab, Ben Garcia, wrote a review for us about mass spec and his perspectives about the field on the basis, basically, because he was participating in this campaign, and that led to us reaching out to him. So I think those are the types of things that were kind of just intangibles almost, even though they led to a tangible product, but we hadn't anticipated it, which was really fun.
Wasn't that fun? The final group of use cases tackles the key question we started with. Can promotion through TrendMD actually increase citations and ultimately raise a journal's impact factor? This first slide summarizes the results of a 12-month randomized controlled trial, actually the first scientific test of its type. 3,200 articles published in 64 peer-reviewed journals across 8 subject areas were tracked for a year, counting the number of citations for each article. Half of the articles were randomly assigned to a control arm, and half of them were promoted by TrendMD. The articles promoted by TrendMD had 50% more citations at the end of 12 months. Results were published in a peer-reviewed journal, the Journal of the Association for Information Science and Technology. For details, more details on this study, including the statistical methods used and a comparative breakdown of the results by subject area, please visit the poster sessions. We've got an exhibit in that session. I have here 3 examples also of journals that used TrendMD with a specific goal of improving their impact factors. This first example is a relatively new open access medical journal from China, which received its first impact factor of 5.9 in 2019, and its second of 13.5 in 2020. Trend analysis for similar journals led to an estimate that its third-year impact factor would drop below 13. And to avoid the expected decline, the publisher ran a campaign with TrendMD for 6 months to help drive their citations. The result was that the citation trends at this point are indicating that the new impact factor for 2021 will be over 17. This example is of Life Science Journal, which received its first impact factor of 13.4 in 2011, which was the highest in the Asia Pacific region. But after that, the impact factor continuously dropped and was at 4 in 2019. Starting in July of 2019, the journal used TrendMD to run additional content marketing campaigns, making a long-term investment of 15,000 credits per year. Their new estimated impact factor for this year is 5.8. This increasing trend in citations indicates a continuous impact factor increase for the next 1 or 2 years. This example is a well-established math journal that received its first impact factor of 0.05 in 1997. The journal's impact factor rose very slowly over the next 20 years. The publisher launched their first campaign with TrendMD in 2017. Since 2017, the journal's impact factor has increased sharply each year, with an impact factor of 0.92 in 2020 and an estimated impact factor of 1.14 in 2021. The publisher's use of TrendMD was part of a larger campaign that also included email outreach, though the journal editors, as well as editors from many other journal publishers, have reported that their best results and their highest engagement came through the TrendMD campaigns. I'm often asked about the TrendMD name. Does MD mean that we're just a service for medical content? Actually, the name comes from our original founding by a doctor who wondered how research papers that he was writing would ever get discovered, and by a technology whiz kid who suffered from a rare condition and wanted a better way to stay informed on new discoveries that might help. Since our founding, we have gone on to promote content in every scholarly discipline. So the MD designation has evolved to the idea that we are doctors for websites that may need a little help with their discovery and traffic. How can your journals benefit from greater discovery, more traffic, or more citations? Let's talk about how we can help. Thank you very much for your attention.